Let's continue our discussion of forensic serology by starting with the collection of the forensic serology samples. Most laboratories use sexual assault kits that are specifically designed for the collection of serology evidence. These kits may have blood tubes in them, they may have envelopes in them that are specifically designed for the collection of samples from either suspects or victims. The kits will usually contain an information sheet so that further information can be given concerning the case to the laboratory analyst. There's usually also envelopes that are labeled collection for known blood, which would contain a blood tube, or in some instances it may now contain a blotter card where blood can be placed and then dried. In some situations, there's also a sample in there where buccal swabs can be taken. Buccal swabs are the swabs that will be taken from the inside of the mouth cheek area. There's also usually envelopes or Ziploc bags that allow for the collection of known head hair and known pubic hair from the individual, and then a separate container also that could contain any pubic hair combings. Depending on the victim, there may also be taken a vaginal swab and a vaginal smear, a rectal swab and a rectal smear, and in some instances oral swabs and oral smears. There may also be taken a penile swab, and in most instances fingernail scrapings are also collected, and then other containers that the analyst or the nurse in the hospital room doing the exam may use for any other swabs of unknown samples or in the collection of any other foreign debris and hairs. In some situations, not all of these evidence containers will be used. It really is just dependent on the circumstances of the case itself. But usually kits are designed so that all of the containers would be there if needed. In addition to the kits, a lot of times there's going to be samples that are taken from individuals, items of clothing or bedding, or any other objects that might also be needing examinations. With blood evidence, there's 4 possible situations where an analyst might be needed to take or collect the blood samples, where there's liquid blood, dried blood flakes that have absorbed into something, or dried blood that presents itself in a pattern. So if we are considering liquid blood, depending on the amount of blood that's available, usually a cotton tip swab will be used to collect the liquid blood, and it's important to try to keep that blood stain concentrated on the swab itself. You always want to allow biological fluids like this to be able to dry, so it would be necessary to place this in something that is paper so that it can continue to dry. You would also need to label it appropriately. There might be the occasion where it's necessary to collect dried blood flakes. This can also be done in a similar situation as the liquid blood, using a moistened cotton tip swab to collect the blood samples themselves. Also, try to keep that blood stain concentrated on the swab itself and allow that to dry. In some instances, the dried blood flakes might be easier to just remove from an item, so you can use a sharp, clean instrument to chip off the dried blood flakes. You want to make sure that you can collect these in paper or something that's going to be very clean, and then label that container appropriately. There's also the occasion where the dried blood may have been absorbed into something. So it might be necessary to use a sharp instrument to actually cut out a portion of the stain itself. Remember, if you're using any instruments to aid in the collection of your samples, you always want to make sure that you're cleaning them in between each sample with a bleach solution. You also want to make sure, after you have cut out the stain, that you're placing it in a paper container or something that is actually clean and labeled appropriately. In some situations, that dried blood might be absorbed into an item that is easier just to collect the entire item. So in this situation, you can fold up the item and place it in a paper bag and label it appropriately. Some blood patterns might actually be dried, so you might want to also examine the pattern closer back in the laboratory, so it might be necessary to collect this item. You want to make sure that you have clean paper or something to collect the item in. If the blood is still wet, you need to allow it to dry, and you don't want to fold it onto itself to destroy that pattern. You always want to make sure that you document pattern blood areas also. So you want to take photographs, and usually you want to take these at a 90-degree angle, and then also including rulers. After documenting, you can collect the sample as previously discussed. There might also be the occasion to collect other wet body fluids, such as saliva, semen, or vaginal fluid, and these can usually be collected by using a cotton tip swab. You want to always keep it as concentrated as possible, and then allow the swab to dry or package it in something that would allow it to continue to dry, like a paper envelope. Keep in mind that condoms may contain both the suspect and victim samples. So if there is any liquid still contained inside of the condom, you want to be able to knot that so that it won't contaminate the fluids that might be on the outside of the condom. There might also be dried body fluids, such as saliva, semen, or vaginal fluid. And in this condition, like blood, depending on the size of the sample, you can use a slightly moistened cotton tip swab to collect the sample, or depending on what the sample is contained on, you may be able to cut out that stain or collect the entire item. There are, of course, advantages to some of these different collection techniques. For swabbing, it's a very specific location, and you do have the availability of concentrating that sample, but it is going to be a little bit time-consuming. Also, with cutting, you know the specific location. It is sometimes time-consuming, and you have to be aware of the possibility of contamination. So you have to make sure that you're cleaning your instruments in between each sample. When you collect the item, it's always very good because the lab analyst has the ability to take their own samples. And this is especially good if there's the possibility that there might be more than one type of evidence present on the item. However, in some situations, depending on the item itself, it might be extremely hard to package large items. Usually, fingernail scrapings or clippings are included in forensic serology samples, and these are usually taken as part of an assault kit. Each hand should be collected separately over clean paper. The problems that might develop from fingernail scrapings is that when all 5 fingers are located in one item, it is harder to know the specific location, and generally the samples that are found under fingernail scrapings tend to be the own person's. There might be occasions where contact biological evidence might be able to be collected. So these might be things that aren't quite as visible, like skin cells or sweat. Usually these samples are going to be collected by the analyst at the laboratory. Especially with biological evidence, you need to be concerned that you are using proper packaging and storage for that evidence. A wide variety of materials can be used, but you need to always keep in mind if the item is wet or partially damp, it needs to be allowed to dry. If the samples are not dry and they're put in something that's going to contain that moisture, it can start to deteriorate the sample. So always use different guidelines when you are choosing your proper packaging and containers, and if in question, always contact the laboratory. All evidence should be allowed to air dry if possible, and if not, it should be contained in a paper container so that it can continue to dry. Plastic should only be used if there is the danger of liquids. So this would be because of the biohazards of the body fluids, and if there is the possibility that it is so wet that it's going to penetrate the paper itself. Tissue and liquid samples should be refrigerated. Liquid blood tubes should never be frozen. All of these samples need to contain the correct labeling, so this would include the name and initials of the collector, the date and time of the collection, the appropriate agency and case numbers, the name of the individual that the samples are being collected from, and a detailed description of the item, including the location of the item, and then the unique identifier for that item. They should also be sealed appropriately with tape so that it prevents items from getting into the container and then also items getting out. It also provides the measure of security. And remember, with forensic biology samples, biohazard labels should be included on your pieces of evidence. The most important thing is that the lack of evidence preservation can render forensic biology samples useless. So keep in mind the samples need to be cooled. They can't be placed in extremely hot areas. In most situations nowadays, after initial serology screening, the samples themselves will go on for additional DNA testing, and this is what we will be discussing in our next lecture.